you may not know it, but December and January are the deadliest months for heart attacks, and there is even something called holiday heart syndrome. This morning, Dr. Amin Al-Ahmad is with us from the Texas Cardiac Arrhythmia Institute at St. David's. Good morning to you. I have never heard of this syndrome before. And what is particularly special about December and January?
Well, holiday heart in particular is when people celebrate a little bit too exuberantly, drink a little bit too much alcohol, and then they can have a cardiac arrhythmia or an abnormal heart rhythm. And that's when the heart no longer beats in a rhythmic fashion and now starts to beat very chaotically. And that can cause a lot of symptoms like palpitations, flip-flopping of the heartbeat, fluttering in the chest, difficulty breathing, things like that. And it can also predispose them to a risk of stroke. So it's a very significant syndrome.
So the effect can be that immediate with all of the maybe overeating or indulging that we do during the holidays.
That's right. We need to watch it. We need to be very cautious about how much we do. And some people are at particularly higher risk for it, so they need to be careful with that kind of thing.
Let's talk about some of the symptoms. What should you look out for to know something could be terribly wrong?
Yeah, so some of the symptoms, the common symptoms are fluttering sensation in the chest, the flip-flopping sensation in the chest, what we call palpitations. Other symptoms are things like difficulty with breathing, exertion. For example, if you used to be able to run up the stairs without a problem, but now you get winded running up half the stairs, or walking up half the stairs, then that may be a marker, and you may need to seek some medical attention if that happens.
What are some of the specific things, the triggers that set it off? I know we talked about the unhealthy eating and alcohol. Anything else?
Now, these are the typical ones: alcohol, unhealthy eating. You know, in some situations, you know, people have a little bit more time on the East Coast. For example, they start to shovel snow, things like that. But here in Texas, I think it's mostly eating and alcohol consumption.
Yeah, and you can reduce your risk, though. We've got some of that information on the screen right now. How do you stop it?
Well, you know, if it continues or if you're feeling poorly, you need to seek medical attention. And we can stop it in the hospital. There are different ways of doing that, either with medications or with other types of therapies. And if it becomes a longer-term problem, then longer-term medications or even procedures such as something called cardiac ablation may be helpful to help with that syndrome.
And then you mentioned obviously limiting alcohol, eating less fatty foods. What about caffeine and sweets?
Yeah, so caffeine is an important one too. So less caffeine and also less sweets, especially for diabetics. Salty foods also, need to avoid them. If you're hypertensive, that can all predispose you to have holiday heart syndrome.
And I see rest up there. Get plenty of rest.
Get plenty of rest and hydration and that kind of thing.
Hopefully people are doing that who have next week off.
Yes, exactly.
Well, thank you, doctor, for coming in.